Acute hepatitis B progression, diagnosis, and treatment. Acute hepatitis B is a liver infection caused by the hepatitis B virus HBV. The illness usually resolves on its own within a few weeks or months, but some people may experience serious complications, even death. Incubation period. The incubation period typically lasts from 6 weeks to 6 months, with an average of 23 months. During this stage, the individual has no symptoms. Symptomatic stage. Early stage. The individual may experience mild symptoms such as fatigue, loss of appetite, nausea, muscle aches, and mild fever. Symptomatic stage. Progressive stage. Symptoms become more apparent, such as jaundice, yellowing of the eyes, dark urine, pale stools, pain in the liver area, enlarged liver, and fatty liver. Symptomatic stage. Severe stage. Some cases may develop acute liver failure, leading to coma, bleeding, infections, multiple organ failure, and death. Diagnosis. Diagnosis of acute hepatitis B is usually based on blood tests. These tests can help determine the presence of the HBV virus, the level of liver inflammation, and the status of liver function. Hepatitis B surface antigen HBsAg test. This test determines the presence of the HBV virus in the blood. Diagnosis. Anti-hepatitis B surface antigen antibody test. This test determines the presence of antibodies against the HBV virus. Hepatitis B e antigen B test. This test determines the presence of the e antigen, indicating that the virus is actively replicating. Diagnosis. Anti-hepatitis B e antigen anti-B antibody test. This test determines the presence of antibodies against the e antigen, suggesting the virus is being controlled. Hepatitis B virus DNA HBV DNA test. This test determines the amount of HBV virus in the blood. Diagnosis. Liver function tests. These tests assess the status of liver function, such as AST, ALT, ALP, bilirubin, albumin, etc. Treatment. The goal of acute hepatitis B treatment is to support the body in fighting the virus, protect the liver, and prevent complications. Treatment primarily focuses on managing symptoms, supporting liver function, and maintaining health. Treatment. Symptom management. This includes rest, adequate nutrition, drinking plenty of fluids, using pain relievers and fever reducers, anti-nausea medications, and antibiotics if there is an infection. Treatment. Supporting liver function using liver protectants, antioxidants, and supplements with vitamins and nutrients essential for the liver. Preventing complications. Closely monitoring the condition, managing complications such as acute liver failure, bleeding, infection, etc. Prevention. The best way to prevent acute hepatitis B is to get vaccinated against hepatitis B. The vaccine is safe and effective and can help protect the body from HBV infection. Conclusion. Acute hepatitis B is a liver infection that can resolve on its own, but there is still a risk of serious complications. Early diagnosis and timely treatment help reduce the risk of complications and improve the prognosis for individuals. Getting vaccinated against hepatitis B is the most effective way to prevent the disease.